This weekend also, we have to tell you we're doing more education as part of just a wrap-up of the Breast Cancer Awareness Month. And we're here to do some conversations. But again, my good friends and also all my folks at Anglon who are celebrating the Hogba Chuchu this weekend. Please make sure that you're watching us, and then we'll give you some wrap-up comments on what we all need to do. We've been discussing a number of things related to breast cancer this very month. And Ketsi, the Nyaho Medical Center, they have two centers right here in Accra. The second one in one of the skyscrapers. And it looks like we've gotten the right sort of education. But after you've gone to do the, is it mazarectomy or something else? Yeah, so I hope I pronounce it well. Irajua, who is a medical doctor who has been with us throughout the last 4 weeks, will correct me if the pronunciation is wrong. What do we need to do? Irajua, thank you for joining us.
Thank you for having me.
Dr. Irajua Yeboah is her name, and you all can recall that. She is a family health physician.
Family medicine.
Family medicine physician.
Resident.
Yes. Okay, with the Nyaho Medical Center. And throughout this month, we've been able to speak to a survivor. You've also been able to do some demonstrable practicals for us as to what we can do in checking the breast. But we also will do a recollection, because at least for all the cases that are recorded, it's also found out that 58% of the fatalities or the deaths are from developing countries like ours. Now, when we spoke to the survivor told us about all the things that she went through and then did a surgery. And you call that?
The mastectomy.
Mastectomy. Yeah, you were just marking me wrong. But in the meantime, she told us about how she was still in between on the thin line. Why, after doing the mastectomy, do you still have to say that you are not out of the woods yet?
So the reason is because of the nature of the cancer. The particular survivor that you spoke to had a mastectomy, which tells us that at least the breast could not be salvaged. Now, usually when it's fairly localized, or where the mass is fairly small and doesn't look like it's spread too much, they do what we call a lumpectomy. Basically, they just take the cancerous tissue and the breast is basically preserved. But once it's too large, then they may have to go ahead to do the mastectomy. That's taking out all the breast. Now, the goal of treatment, or the ideals of treatment, is that you want to get rid of all the cancer cells. Sometimes it's not feasible or possible because of the staging of the patient as to how advanced the condition is before the patient showed up. So even though you may have removed, should I say, the primary source of the cancer, there may be a few other cells either close by in the general region or even spread further through the body. So depending on that, you'd have to go a bit further to get rid of the cancer cells. Yeah.
And we have to say that we've also made available, we'll open the phone lines later as we're wrapping up, but we have 0540 10 909, which is our WhatsApp platform for you to also communicate with us. If you're a survivor, or you are related or around somebody who is experiencing all these difficulties, or you want some questions asked, let us know. We'll get there. But the number for you to send us messages on related questions, your experiences on breast cancer, as we wrap up the Breast Cancer Awareness Month today, is 0540 10 909, and it will be on your screens very soon. But so it means that you have to be diagnosed by a specialist. Do we have many such specialists around who ultimately will then perform the surgery, the mastectomy?
Yes. So actually, breast cancer is actually handled by general surgeons, really, and we do have a good number of them. Of course, we don't have enough specialists in Ghana per our population, but in terms of representation as a whole, we do have a good number of specialists, and so you can have the surgery done at a number of facilities, not just the big ones we always hear of like Kolebu and Komfanoche teaching hospitals. The add-on treatment is what you may need to go to a bit of an advanced facility in order to access. But in terms of the surgery, there are a good number of surgeons who can do that for you. Yes.
There was the other time the interaction Mama V had on the Cosmopolitan Mix on Joy FM with Stephanie Benson, who said she made that decision to remove both breasts. At what point in time do you have to make that decision?
So usually for some people, what motivates them, and especially seen in the developed country, is what's some of the cancer types are seen to have a familial running. So it's more like you have a specific gene that predisposes you to breast cancer. So a few people take that very bold decision to say that, you know what, it looks like I'm at risk. I have the gene, I have a mother, a sister, aunties who all have the breast cancer. So I will decide that rather than wait for the cancer to occur, I will just take it out. There are also cases where you can have both breasts affected by the cancer. So some do it as a preventive measure, and then others too, as a result of what kind of cancer they have, they also decide to take both off.
Is it expensive?
So,
or is it covered under the National Health Insurance?
So it is covered by health insurance, and even breast reconstruction is covered by the health insurance. And a lot of times, the reason why a lot of women don't want to do the surgery is because they are concerned it will disfigure them, it will make them look unattractive, and a whole lot of self-esteem issues. But the good news is that the breast reconstruction is covered by health insurance, and depending on your staging, they may either do it immediately after they do the breast removal, or they may do it a bit after, depending on case to case. But yes, it's also available for patients, and it's covered by the health insurance.
Yeah. Can it be done by, what structure per our Ghana Health Service health facility tiers could undertake or do the surgery or the mastectomy?
So for the mastectomy, really, once you have a general surgeon in your facility, it can be done. For the reconstruction, however, it's usually done by plastic surgeons, because they have specialized in making aesthetically beautiful, finishing. So you would need a plastic surgeon who would do it to make it look more natural, to make it look more, should I say, believable on the physique of the individual. So once you have these two available, and again, it's on a patient-to-patient basis. So once the person is assessed and it seems feasible, there's no reason why it can't be done once these specialists are available.
Yeah. Now, after you've gone through all that, whether you removed one or just a fraction or both, what will you be going through? What should you be doing?
So again, we have to come back to the previous assessment, okay? Because there are different types of cancers out there. Even though we put them all under the umbrella of breast cancer, there are different types. Some are stimulated by estrogen, which is a hormone the woman's body produces. The others are by progesterone. There are so many other markers. So first of all, we need to determine the kind of cancer that it is. After they've taken it out, looking at the type of cancer it is and then how much it's spread, we determine what can be done for you. And there are various modalities. After you've recovered from the surgery, radiation therapy is available for you. They use X-rays to try and target the cancer cells. And even with that, they have what we call a localized radiation brachy therapy, where they actually put it at the site, or they do what they call an external radiation, where you go under the machine and the rays are emitted from a machine. Again, the particulars are dependent on the individual's particular case. You also have chemotherapy, and chemotherapy basically is strong drugs which are given to try and destroy the cancer cells. And it may be one drug or it may be a combination of drugs. Again, it's dependent on the individual's particular makeup, which can also be given, and usually that's given when it's a bit generalized, because the chemotherapy is given intravenously, which is through the blood, so it gets to travel everywhere to take care of the cancer cells there. We also have immunotherapy. It's boosting basically the body's immune system to try and target these cancerous cells so that the body can take care of it. And then we also have, you remember I mentioned the estrogen positives, cancers and whatnot. So there are also other medications that are also given to modify this as well. So the medications may either block the body from being able to absorb the estrogen or actually block it from producing estrogen at all. And there are a lot of other issues. There are also medications which are given to help with bones, especially people who have had the cancer move into their bones. So they can give to them, it helps to strengthen their bones, it helps to take care of the cancer which has just radiated. So really, there are various modalities which are available, but it's more tailored, it's an individual fit. So you can't really say this person got X, so that's exactly what I'm going to receive, or that's what I'd want to do.
So it varies person to person.
It varies person to person, and even factors like the age of the individual too
also matters.
Yes, because somebody who is menopausal may have some leeway in terms of the medications that you can give to them. Others who are in childbearing age, reproductive age, their hormones, ovaries are producing estrogen and whatnot. You also may have to also tailor the medication to suit them. And one of the things people don't realize is they try to take into consideration your personal plans. There are some people who say, no, I've not even had a child yet. Going through this may prove, make it a bit difficult for me or reduce my fertility issues. So maybe I want to freeze an egg. I want to have a baby first. So all of these things.
Freeze egg, Ghana.
So now there are a few, there are private facilities we do that, but as you can imagine, it's quite expensive.
To keep your egg there?
Yes,
to be
for
used
a limited, to be
date.
used at a later date. There are others too who decide that they want to actually have their children first or have at least a child first. Others too may decide to use a surrogate. So you give your eggs to another person to carry whilst your body is undergoing these treatments. So we try to accommodate every single person as much as we can. Okay.
Yeah. Now we're talking urban, because Nyaho and the big facilities and the referral hospitals are talking very urban. But what are some of the most difficult encounters with either patients or categories of the population who have been affected or could be affected in rural Ghana, for which we need to pay attention to before we get to the next stage of, or the next month, next year of marking another breast cancer awareness month?
I think that's a very valid question. Not everybody, even though we seem overpopulated here, not everybody lives in the urban areas. But now a lot of focus is also being done in education. So a lot of outreaches are being done. Yahoo, for instance, has done a few outreaches, and all the other facilities which are trying to promote the breast cancer awareness programs, they try to do a lot of education. And we are trying to deal with the misconceptions that people have. Whether it's of a spiritual cause, whether I can pray it away, it's only when you do this, when you go and take the orthodox medicine, something will happen to you. These are issues that we need to take care of, and so that's what we are trying to do. In addition, we are trying to educate more volunteers so that they can go into the communities to do examination for people who don't know how. And if it's a volunteer,
those who have had experience or not?
So for the volunteers, what happens is they are actually trained. So there are workshops which are held for them, and then they are trained so that they can go out into the communities to examine people and then act as a liaison for them and then other referral points so that they can easily transit into
I noticed that there were some related issues I read about if you have to do, is it the mammogram?
Yes.
Okay. In relation to the age?
Yes.
Why is that?
So it's more to do with the composition of the breast tissue. Okay. Basically, what the mammogram is an imaging study. So you want to try and have a look at it and make sure that there's nothing suspicious there. Women are very different from men in the sense that we are constantly evolving. And depending on the phase that you find the woman, her body composition changes slightly. Now, for a younger woman, usually those who are below the ages of 40, we recommend an ultrasound because that's what's able to better pick up any changes in the breast tissue. But in older women, we recommend the mammogram because that's also what's better. Usually by that age, the breast tends to be a bit more fatty. The glandular tissue, that's the tissues that help to produce breast milk, are less prominent. So it's easy to pick up from the mammogram. But for younger people, the ultrasound is much better in picking up these things. So it's just more of trying to use a better technique in order to get the best results.
But not that they have any reactions at all?
No, so
So
the ultrasound is basically sound waves. So that's virtually side effect free. The mammogram uses more of x-rays. So it's not something that you'll be doing every month or every week. What we recommend is that after the age of 40, you can do it every other year, or depending on your peculiar set of risk factors, because if you have someone who is high risk, apart from the genetic issues and whatnot, this person may have had some exposure to some other cancers or whatnot. You may want to do it earlier. So again, there are general guidelines, but we try to also look at the individual.
And we have the phone lines also there, 03022116991 or 2. Again, 03022116991 or 2. Let us also hear from you. And the WhatsApp platform is also down or just on your screen. We have 0540 10 900 9. Okay, so let us hear from you as well. I have this question, and I don't know whether this is one of the misconceptions. This one, she didn't send the name. It said, do we have any vaccine for prevention?
Unfortunately, we don't. We don't have a vaccine as at now for the prevention
for many cancers.
For many cancers, actually, yes.
If not all cancers, I think.
Cervical cancer, okay, there's a vaccine, but for most cancers we don't, and breast cancer in particular, we do not, okay, unfortunately.
Okay, and this one is from Kwame from North Kandishi. And he says, good morning, I have a friend who is 26 years old, but she has a small breast, and into bracket, it's only the nipple that is showing. There's nothing like any breast, or even a big one. I want to know what may be the cause of it.
So it's maybe genetic.
So the question I have to ask in relation to this, is there any relation between
the size of
the breast, how it formed, and then the
so there's really no relation, but the only issue is that people who have smaller breasts, they may be able to detect it a bit earlier because there's less tissue to sort of cover up for them. But when people tend to have larger breasts, or when they tend to be a bit obese, it makes it a bit difficult to spot.
Okay, so please make sure that you keep calling, and the number is 03022116991 or 2, and we have the WhatsApp platform as well, 0540 900 10 909. We have already Irene on the line, calling us from Winneba. Irene, good morning, and what's your contribution?
I want to thank the management for educating us on this program.
Oh, you have been following?
Yes, I have.
Thank you, Irene. We're so grateful. Please, what's your contribution, please?
Well, I will still encourage my fellow women to go in for the screening. My mom is a breast cancer survivor, and it wasn't easy for us handling it. But by the grace of God, she's alive. She had the surgery. Initially, she didn't want to, but we were able to convince her. We had some doctors to convince her, and she had it. And it's about 4 to 5 years now she had it. By the grace of God, she's still alive. It's not easy. When it sets in, it's not easy.
What are the experiences from your mother's period or treatment?
Well, we were fortunate to have a doctor who was so dedicated, who was so caring, and from time to time we visited. It wasn't easy financially, emotionally, and a whole lot.
Yeah.
But by the grace of God, I will always say by the grace of God, she's still alive and life goes on.
All right. Please make sure you keep the calls coming in, and that's from Irene. So what would be your contribution then to Irene then? Because now the mother is a survivor. Is Irene gone? Okay. the mother is a survivor, but what should they be doing medically again?
So definitely, once there's been that exposure, we are always on the lookout for a recurrence for Irene's mom. And Irene as well, her sisters, they now need to also be a bit more wary. They need to have a bit of a high alert going on, because once the thing has been seen in your mom, there's a slightly higher risk that you may also develop it one day. So you need to be on the lookout.
So then the risk factors within those individuals are higher.
Exactly.
Okay, so I have this one from, it says, I love sucking breast. Am I putting my wife at risk, or am I saving her from getting breast cancer? That's from Ernest.
So it doesn't contribute, sucking of the breast doesn't contribute to breast cancer generation. It doesn't.
It's not one of the.
It's not one of the causative factors.
Okay.
No, it isn't.
So we have Kenneth from Cape Coast. How did you cope with that? I hope you were not affected by the floods, Kenneth.
No, sir.
Okay.
No, sir. Actually, the zone which I'm in right now is the place where it was calm, but our brothers from the stadium side are the one who got affected, and my prayers are with them.
Okay.
My prayers are with them.
All right. Please go ahead. What's your contribution on the related subject under discussion, breast cancer? Is the last day we're treating it?
Please, I wanted to know, what role do men have to play in this breast cancer awareness?
Okay, thank you, Ken. Let me take the second one. Rose from Aguna Nkwanta. Rose.
Yes. I want to ask, where can I get a screening for the ultrasound? Which hospital is available?
At Aguna Nkwanta, or you want to know the levels of the hospital category you can go to?
Yeah, that they are doing the screening, or where I can get access to the ultrasound.
Okay, ultrasound. It's ultrasound. Okay. All right, so that's Rose. But let's treat Rose, and then we'll go to the role that men can play, and that's the question from Ken from Cape Coast.
Okay. So to answer Rose, you can't do the ultrasound in any secondary or tertiary facility, but usually what we recommend is that you need to go in for the screening first to see whether or not there's a cause to do the ultrasound. It's not just a matter of because the ultrasound is there, you just go and get the ultrasound done. At the end of the day, you'd still need a doctor to screen through the reading. And there's no reason to put yourself through that unnecessary financial cost if there's no cause to do so.
Yeah.
With regards with
Ken, who wants to know any assistance men can, or the role that men can.
So I think that first of all, I mean, your partner, if you notice anything unusual about the breast, don't assume that, oh, if I have seen, then probably she has also seen. You can comment on it. I think this is happening. It seems I've seen this. The other part is more of an emotional support where you try to be there for the woman, because it's not an easy thing, like Rose mentioned. It's not an easy
She just
position.
said it easily, but the experience is difficult.
It's very difficult, and she needs that sort of support to know that you are with her, whether your mom or your sister, that you are there to support her. And honestly, there are times where they won't even physically be able to do certain things. So it would help if you could also help out in one or two things that
so
they
you mean they become
done.
incapacitated one way or the other?
Sometimes, at some point, depends on who, you know. Yeah.
And then we also have to add that it's not only the men, you also have to check yourselves as well.
Exactly.
Because at least it's known worldwide, per the statistics, 1% of men also get infected. But let me just quickly go through. We still have the phone lines open, but we have a couple of the WhatsApp platform messages coming through. I have this one from, well, no name. It says, okay, Haria from Paboso. Can someone give birth after a lump is removed from the breast?
So assuming just the lump is taken and everything is localized, there's no reason why the person can't have a child afterwards.
Okay.
Yes.
This one from Justice Doe says, I'm watching the program from Asaman Kese. So question, also like, okay, but thank you, thank you also for, it says, anytime I suck breast, my malaria goes. What causes the parasite to go? This one is a misconception.
I really can't comment on. It's not been in my
No, you're a
experience.
medical doctor, so comment. Medically, can sucking breast...
Medically, to the best of my knowledge, no, but
okay.
Yes.
Yeah, so sucking breast doesn't cure you of malaria. I mean, that's the... Okay, this from Eric, Accra. Where is screening done, and how does it cost for it to be done?
So,
and can the screening be done if no sign is still seen or is not seen?
Yes, so the screening is done so we can pick up anything that you may have missed. And screening is being done in this month of October in a number of facilities: Kolebu, Police Hospital, 37. Nyaho just had their last one yesterday because theirs was only on Wednesdays. But apart from October, you really can't walk into any clinic and see a doctor and ask them to screen your breast.
Okay, I have this one from Hamidou, who is giving us this message from someplace in the Upper West region. He says, thank you for the opportunity for this education on TV. Please, I want to know if a woman is having breast cancer and you suck her breast, can you, the husband or the boyfriend, be infected?
No, it's not infectious. Breast cancer is not infectious.
Okay. It says, this one says, good morning. Where can I get cervical cancer vaccine? And then I think she adds, I also have a small lump a little above my breast, which is painful. What should I do?
I think you need to see a doctor with the lump in immediately and let it be assessed and screened.
Okay.
And with the HPV vaccine, you can go to any facility. I think right now it's even available in some public institutions. So I think Kolebu should have it.
Okay. This one is from Sister Letitia, not telling us where she's giving us this. It says, can men also have breast cancer? And then I have a boy, means a child, who has big breast.
Okay, so men can have breast cancer. And a boy with big breast, a lot of times it's usually due to obesity. There are other factors too that can cause that. You can have it checked out by a pediatrician, but breast cancer, thankfully, tends to target an older population. So that wouldn't be the first thing that you would think of when you see a small boy with
You mean
breast.
in the men? The statistics indicating that it's in older men?
In men and in women, you know, it doesn't usually target children. It's not so common in children. Yes.
Okay. Apepuo Emmanuel from Upper East region said, your doctor has done very well by digesting the issue. I've learned that men too can get breast cancer, but we the men don't have breasts. How?
So actually they do have breasts, it's just not as large as their women's. So you can also do the breast screening exercises if you notice any lump or any swelling. Sometimes it may seem as if it's your packs which are coming, but it may be something else, especially when it's just on one side. So you just keep an eye out and then you just keep checking.
Okay. Yeah. You want to know, you didn't say your name, you want to know whether NHIS covers full treatment? Yes, it does. Yes, you have confirmed that. Good morning. A pregnant woman complaining of pains over the breast. What may be the cause?
So the hormones too can sometimes make the breast a bit more sensitive. All the hormones when you are pregnant. So that can happen. And that's why we are trying to say that pain is not really a sign of breast cancer usually. There are other things.
And this one will be the last one, or last but one. Good morning. My sister has been diagnosed by the Swedish Medical Center. She will undergo the chemotherapy there. Can Yahoo Hospital also perform the surgery there if she's referred there?
Yes, so for the surgery, it just has to be under specialist care and she can go there for the surgery.
Okay. Yes. All right. Let me read the last one before we let go of you. Good morning. Sogbo Kakali. What if my woman has been feeling pains all the time in her breast? What will be the cause?
There are a number of causes. I think it would be better if she were to go to the clinic for a thorough assessment. Yes.
All right. Bubune from Volta region, breast cancer cannot be transmitted, you know, like the normal way. Thank you very much. And we've been having some great time with you, family resident with the Yahoo Medical Center. You have two branches. The
one at Octagon and Airport.
Right. And Dr. Irajwa Yeboah, thank you very much.
Thank you.
And I hope that all of us also, throughout the last 4 weeks, we have been educated on related issues about what we need to know, and then the issues of risk factors where we have to seek treatment and what happens post-treatment, and also related issues on stigmatization. We talked about that, I think, the second episode. But we know that our society is always having this kinky mind about what breast cancer is and the stigmatization, but nothing at all. She's dealt with it over the period. But thank you very much. Thank you for passing through.